Hi, my name is Mike Curvin, or Michael Curvin, and I'm retired, and I live here in Brookings. I like bike riding, hunting, work with kids in the outdoors and stuff, but that's pretty much it. It'd been hurting major hurting, to the point where it affected my walk and affected my attitude and stuff for probably about a year and a half or so. I turkey hunt a lot, and I was asking one of the guys I was turkey hunting with, I said, do you remember me limping and hurting? And he's like, yeah. He said, you were complaining about having to, carry this. We thought it was just you complaining. And I'm like, well, I was. And I finally just couldn't take it anymore, where it hurt just to walk. No, I'm a little low fashion on that. I mean, I took the ibuprofen and did that as needed. Unfortunately, it gets to the point where I was taking it like candy and that. So that's one of the things too that I knew I just had to stop and get it fixed right. And I didn't know the results would be as good as they have been. So really nice. I mean, he reminded me a little bit of me, and that, every question, the answers, he gives the story, so behind it. He did, the x-rays and, went through the normal. There he did show me the x-rays, and my wife was with me, I think. And we went through and saw that, and he pretty much told me what has proven to be true is he basically made the pain stop. Not completely, and not walk on water type stop, but it's not a constant pain. Oh, excellent. Like I said, I've been here before, obviously, for different things. It'd be almost like if it was a family member taking care of us. Recovery went fine. It's as been our common theme as I go back and get my 3-month check and 6-month check, and then a few weeks ago we did the blessed with holy water, you're done, get out of here, son. And but the pain stopped, and that was one thing that we talked, and it's continued the whole year, to not be that pain. Occasionally, if I ride 20 plus miles one day, the next day I might be hurting. If I walk the dog, then the dog walks me and it's pulling on the leash. Well, there's times then that'll be like, dang it, it's sore, but it's not debilitating. Well, that it worked. But I think the most is Dressander's attitude towards the whole thing, is like I said, it was like, the guy who lives next door brings a couple beers over to say, hey, how you doing? But I appreciate the fact that he was always positive. He asked about the pain. One time I came in because the ankle was acting up so much, and I think because they got this part fixed, that's kind of like the chain reaction here. And so when I was here, then I got an appointment with Prusa that same day, and he gave me the shot in the ankle, and that was the first time I remember in over a year that I could go down the stairs first thing in the morning and walk down the stairs, not one step, because it was everything was hurting so much. I did go to PT. He was in contact with Dressander, obviously, and went 3 or 4 times, and he's like, you don't need this. He says, you're doing fine. So just keep doing your stuff at home. And, then I had the stretch bands and stuff, and I did what on the sheet, I did what they told me to do, and I did that. But I agreed there wasn't a need because there wasn't the pain, but I'm sure because I was doing it, that probably lessened the pain. It all worked together, with the actual physical stuff of fixing the hip, to the muscle stretching and all that stuff. Well, I'd say it works. It's not the, you read the stories or watch 60 Minutes or something, and they're always taking people off to super hospitals and stuff. And I got wonderful care right here. Never had to leave town. Never, had people supporting what I was doing and needed to do. The follow-up was excellent. It was just come in and see him and get the appointments. I mean, even to the point one day where I said, well, I'm going to have to come back and get a shot in the ankle. she's like, well, wait, let's see what they got on their schedule. And called back to the back and got Prusa was available, and she set me up, and in 10 minutes I had an appointment and sitting in the room waiting for her, so.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.